Is Rachel, and I just want to welcome everyone to our October West Side Association meeting. I am the current West Side Association president. For those of you who are not familiar with what we are an organization to assist and encourage the growth and promotion of West Side businesses and our community. We meet monthly. We meet the third Thursday of every month, and we are 12 to 1 o'clock. We are always welcoming new members. So if you're interested, please feel free to check out our website or our Facebook page. We usually start with our treasurer's report. I don't think Mike is on to do that today. So John, if you'd be willing to give us a chamber report, we would love to hear what's going on.
Okay, will do. You hear me okay?
Yes.
October is going to be a pretty robust month for us. We got a lot of programming, mostly virtual, which appears to be with us for quite some time here. So, but a lot of ongoing seminars, webinars, that sort of thing. We have a Leading from the Top program that is a two-part program that started October 8th, and the follow-up will be on November 12th. But Joe Thompson and Vicki Updike with Differentiating Strategies will be presenting that. And for those of you, it's for really owner and higher level managers to start thinking about, you know, how do they think about working on their business strategy and development, that sort of thing. So that's a good program, a good series that we've been doing with them. And both Joe and Vicki are top-notch folks. So they, if you're so inclined, try to register for that. All these things, if you remember, it's included in your membership, so it's no fees attached. Today we started our first of our three-part series on municipal budgeting and budget briefings. We had Mark Roloff with the City of Oshkosh give us an update on where the city is and where they'll be headed in the next, probably 1, 2, 3 years. It's certainly the long-term effect financially on a lot of organizations is going to affect many for the next, not just months, but years ahead. So next week we have Mark Harris, county executive, will be talking about the county's budget and what they have in store. And then we're going to end up on the 15th with Superintendent of Schools, Vicki Cartwright. So she'll be probably talking about that, probably also be talking about the upcoming referendum on that the school district has on the ballot on November 3rd. A couple other things. We're doing OC Connection, which is really a program to help members share other referrals, and we kind of go around usually around the room. Now it's around the screen to talk about what companies are doing and kind of do a 1-minute, 2-minute elevator pitch for each business that participates in that. That'll be on October 13th. We're doing a social hub on Tuesday, October 20th. It's done by Tyler Hoffman with Stellar Blue Technologies. We'll be talking about multimedia, how to leverage video and photos to increase engagement online. That's a series that we do every month. And if you're needing more enhancers and so on how to use social media, especially right now, it's a good series to listen in on. Every third Thursday of every month, we have our HR breakfast briefing with Von Riesen and Roper. Don't have a topic of that yet, but it'll be on October 15th, Thursday at 8 o'clock in the morning. We are continuing on our Thursday schedules of virtual town halls. On the 22nd, we have a candidate forum with Gordon Hentz. Will be squaring off with Donnie Herman. We're trying to work through the technology on this. It's going to be simulcast through, it'll be live on WOSH at 8 o'clock on that Thursday morning. And then we're also going to be doing a virtual option for people to tune in on that. So that should be a good program. Then the following Thursday on the on the 29th, we're doing a 18 Senate district forum with State Senator Dan Fine and his challenger, Aaron, I think it's Wojciechowski, I think is how you say it. So again, it's going to be simulcast live on WOSH and also via a Zoom. Ideas Amplify is coming out again on programming on the 22nd of October. Again, it's virtual. Talking about purposes driving digital transformation. Tina Seashore, who is the VP of Global Rewards for Oshkosh Corp, will be the guest speaker on that day. So should be a good program. We are doing a business after hours this month. It's the first one that we've had since July. It'll be on Thursday, October 15th at TJ's Harbor. Hoping we get a lot of folks that come out for that. And it's going to be in the, if you've ever been out to TJ's Harbor, they have a kind of a new meeting area, reception area with sliding doors. And so we'll be opening up the doors and hopefully people come out to that. Appleton Airport is going to be doing a giveaway of a $500 American Airlines travel voucher to promote their new nonstop flight to Charlotte, North Carolina. So you have to be there to win, to register, and hopefully we get a lot of folks showing up for that program. Sponsors are not just TJ's Harbor, but also Bank First is going to be co-sponsoring that for us. In terms of, we just finished our fiscal year yesterday, and today is the first day of our new fiscal year. And with that always comes a new slate of officers and new board members. Elected at our last board meeting, new board members include Fred Steffen with Amcor Flexibles of North America. He's the president of Amcor here in town. Nick Benke, owner of SBG Financial, is joining us. Robin Gruner with AT&T, and then also Jim Macy, partner in the law firm of Von Vriesen and Roper, our new board members. And then a new slate of officers. Wilson Jones is going to be our new chairman of our board starting today. And with that, Javad Ahmad is past chair. So Javad did a great job for us over the years, kind of in a tough year for everybody, and where we've had a little different types of programming than we normally have been able to do. And then Joan Wolt with Bank First, she's the market president. There will be our chairman-elect. And then so that's Wayne Youngworth continues as vice chair. Brian Wierzbinski with EA is our treasurer. So that's our slate of officers for the upcoming year. In terms of a couple other things, new employment data came out, and there's some good news out there. Our unemployment rate for August is at 5.3%, which was very encouraging. Back in April, we were hoping to get it down to, we'd be around that 7% mark, and we're down to 5.3%. It was at 14.3% in April, so that's quite a change for us, and that's good to see that. I'm hoping we can sustain that over the next 3-4 months, but time will tell on that. To give you an idea, the county is at 5.1%. Again, that's down from April. Last year at this time it was about 3.3%. So it's a bit different than what we've had in the past there. In terms of state unemployment rate, we're at 6.1%. So we're doing better. We're doing better than most. We just need to sustain that and hopefully continue to build on that sort of thing. The Department of Revenue came out with new construction numbers for 2020, which is actually 2019 numbers. They lag a year. But Oshkosh did pretty well with our counterpart communities in the valley. We had over $42 million of new commercial construction during that time. That's a big number for us. I think it's the highest that we've had since 2009. So that's certainly a good thing to see. And also Oshkosh was second in the valley with new industrial construction with over $22 million of new industrial construction. So, very, very robust. It's those are good numbers. It's good numbers to see as we move forward here. Something that I want you to be aware of, and I know we've been waiting on this for quite some time. There's going to be a groundbreaking ceremony on October 21st at 3 o'clock for the Town Place Suites by Marriott over on Oshkosh Avenue in the shadows of the Oshkosh Corp offices. So that's it's good to see that moving forward, and we'll be breaking ground on that day. So we'll be promoting that. So please come out. That's good stuff for the West Side folks here. As you've probably seen, construction is underway on Lakeshore Plaza. The CLA offices and that office building is under construction, and there's also a 6,000 square foot retail center that's under construction that will be housing Dunkin' Donuts and Baskin Robbins and all sorts of other things to keep your weight down, So, and then the Brio building construction commenced. I can see it from my office here. It's they're starting to go vertical here, and that's going to be home of the food co-op in that market, along with a residential units above on the upper floors. And then lastly, also on the west side, construction continues on the Chick-fil-A, and I know people are anxiously waiting for that opening. I think it's going to be open before the end of the year. So get in line, get your car in position so you can get through there. And then lastly, a Discount Tire is also under construction. That's right next to the bar over on the frontage road. So a lot of activity on the west side. Good stuff going on in Oshkosh. Hopefully there's a light at the end of the tunnel here, and we can keep this thing moving. So I don't know if anybody has any questions or thoughts or comments. I'd be happy to entertain those.
Sounds good. Thank you so much, John, for all that information. Sounds like a lot of things going on. And if anybody has questions, feel free to reach out to John, or they always have a calendar of events on their website. So wanted to just update on a few things, some old business. Last month, we talked about a speaker donation of $100 to their charity of choice. Last month, we had Amy Albright, and we did donate to the Grand. Doug, this month, wherever you'd like us to donate to for your charity of choice, we'd be more than happy to do that on behalf of Westside. A little bit of new business. Moving forward, we are going to do a member spotlight. So at each of our meetings, we are going to spotlight 2 members and allow them a couple minutes to talk about who they are and the organization that they represent. We'll also be promoting them and their business on Facebook, on LinkedIn. So if that is something as a member you are interested in, please feel free to reach out to either Patty or myself, and we'd be more than happy to spotlight you as a member. Just some housekeeping rules. We are going to go ahead and get started. Doug would like this to be an interactive presentation. So if you have questions as we go throughout, please feel free to unmute yourself and ask your question. We are more than happy to take those questions. Otherwise, there is the chat feature. You can send that as well. So I'm going to go ahead and get started and introduce Doug Gieryn, who is the Executive Director for the Winnebago County Health Department. He has been the Winnebago County Health Department Officer Director for over 16 years. After 11 years of working for the City of Milwaukee Health Department in communicable disease and environmental health. Doug is a past president of the Wisconsin Public Health Association and led efforts to consolidate 3 of the county's health departments. He lives in Neenah with his wife, Jen, and 2 children, a son in college at UW-Milwaukee and a daughter in Neenah High School. And so we are very excited. Thank you, Doug, for your time, and we're excited to hear what you have to present.
Thanks, Rachel. I can append to that. My daughter's no longer at Neenah, at least for another week. She just got sent home today. She had got exposed at school to another student that was positive. and actually is on her way to the Sunnyview Expo Center for her COVID test. And my son is in Milwaukee, was down there for weeks prior to school starting. A couple weeks later, school opened up, and one of his roommates moved in. A week later, he was positive, and then a week after that, my son was positive as a result. So it's just everywhere right now. I don't have a formal presentation. What I'd like to do today is just kind of walk you through the current situation. Things have been changing so quickly here that I think just kind of presenting to you where we're at right now is going to be the most useful. And then I would really appreciate hearing from you what suggestions you guys have in terms of, what are some efforts that you think that, the community can do, that the business community is receptive to try to help limit spread, because we're definitely in a critical situation here. I'm going to pull up our situation report, which hasn't been published yet, just to kind of walk you through what the current situation is. Can you all see? Can you see that? Okay, great. So just to kick off here, as of at least, certainly as of today, New York Times lists Oshkosh Neenah as #1 in the nation for the most activity currently. So this is unfortunately not the first time that we've been on their list for a number of weeks, but I believe this is the first time that we have been the #1 hotspot, in addition to being the #1, actually one of the top with increasing rates. It's not just Oshkosh Neenah, it's the whole Fox Valley. Appleton and Green Bay are also in the top 5. So we have seen exponential growth of cases over the last few weeks. And that really, and by that I mean a doubling of cases every week from the week before. And so in 2 weeks, it's 4 times, and in 3 weeks, it's 8 times. It's grown that fast. So we really are trying to get a message out here for people to really use precautions. There are thousands of cases of COVID right now in Winnebago County. You should assume that any place you go right now probably has a positive case and that it presents a risk to you. So it's really important to maintain physical distancing and to wear a mask. One of the biggest issues right now is hospitalizations. I'll show you a chart in a little bit about that. Our hospitals are pushing 90% capacity right now. A month ago, so it's October 1st, as of yesterday, I think there were about 112 persons in our region that were in the hospital for COVID, that were positive for COVID. At the end of August, it was like 13 or 15, and that's how much it's grown in 4 weeks. It's continuing to rise at a very rapid rate. I have had a call every week. I have a call with some of the hospital systems, and with the way things are rising right now, unless we can turn the curve here a little bit, the hospitals will be overwhelmed in just a few weeks, most likely. They will have to start canceling, any of the elective surgeries. It's going to be, they'll be pushing probably people out sooner than they would like to, and it's going to be more challenging to address those that truly need and will have to defer some procedures because the hospitals will just not have the capacity. I can localize this to Oshkosh. I had a conversation with Dr. Newman, the president of Aurora, yesterday, and he clearly outlined that just because a hospital has beds, it doesn't mean they have capacity. The current capacity Aurora is 200 beds. They routinely staff for about half that because it's really not efficient to staff for more beds than you need and have staff with no patients to treat. And like us, with a surge in cases, We look at our team in public health that's been doing contact tracing and disease investigation. We've got 40 people doing that, something like that right now. And that was before we had a quadrupling in cases. We can't quadruple our staff in 3 weeks. It's not feasible. And so we've had to resort to really high priority, high urgency, type situations, and then rely on individuals that are infected to help us out with contact tracing. We're still doing it. We just can't keep up, despite the number of people that we're hiring. We've also gone to a lot of just-in-time training just to get people notified that they have a positive test. Right now, about the best we can do that way is just let people know, hopefully within 24 hours, that they're positive, what their infectious period was, and to start letting people know and direct them to resources about what to tell people. And then we follow up on those higher risk ones to make sure that, we're really covering well those cases that, are in a school or a daycare or, a group living situation. And also pulling away from our resources, because there's now so many cases in the community. We're seeing so many more outbreaks in businesses and in long-term care facilities that are pulling our resources to help manage those organizations with their outbreaks. So it's just further compounding our ability to do follow-up with individuals that have tested positive. So you can see those numbers there. Hospitals is really a big story right now. That's really gonna impact things moving forward. And unless we change behaviors in our community, this is going to keep going for a while. I mean, it'll eventually naturally peak and come back down, but we'll be, running at a higher rate, than we had been, and essentially just waiting for that, that next ramp up to occur. We've really lost the control. We've lost public health because of the rapid escalation of cases, has pretty much lost control of being able to suppress cases through testing and contact investigations. It's helping, but it's not nearly enough anymore. So we've just not been able to keep things low. Things really, we had in the spring, we had a big takeoff with our young adult population, and that settled out a little bit. And now with school, when UW started, we had the same thing, but even more intense than we had in the spring. And now those rates are starting to come back down, but it's rippled through the whole population. Now every age group has increased in its numbers, and it's widespread. Across all age groups, roughly half of all of the cases that we've had since March have occurred in the last 2 weeks. And like I said, that's because we're doubling almost every week, or at least every time period that we put a report out. So this hasn't been published yet. So I'm just giving you the notes from that. It'll probably look pretty similar to this by the time we get out. Our confirmed case rate, is over 1,100 per 100,000. That means more than 1% of the entire population in the last 2 weeks has tested positive in our jurisdiction. And for our 18 to 24-year-olds, it's been over 2,500 cases per 100,000. So in a 2-week time period, more than 2.5% of the known population of 18 to 24-year-olds have tested positive. The true number that have tested positive is multiple times that. You can see our doubling rate right now is about 2 weeks. You can see the case rates there. Testing percent positivity, our goal is to be below 5%, just to know that we've got enough testing and that we can identify enough people to help control spread. That's run up, it's up at 15% now, and climbing each week. And even with the additional testing that we've added, we're averaging over 900 tests in our service area right now. And when I say our service area, I just want to clarify for Winnebago County Health Department, it includes all of the county except the city of Menasha and the sliver of Appleton that's in Winnebago County. And so roughly about 90% of the population of the 170,000 are in our jurisdiction. So I'm talking about a population of about 154,000. As I mentioned, our contact tracing has been overwhelmed, and people really need to heed caution right now, especially if they have an underlying health condition. And that's like 60% of our population. Between obesity and other underlying health conditions that COVID complicates, that's more of us than less of us. So let's try and hit a couple of graphs here for you, so you can see these are case counts in the past 2 weeks, and you can see the slope of the average case count going up. So we're averaging an average of 126 cases per day over the last 2 weeks. But the way it's rising, today we had almost 150, and that's kind of where we're at right now, at least for the last few days, is in the mid 100s range. And you can see we've gone even over 200 in a single day. There's kind of a map of from when we started back in early to mid March. That middle peak there is that peak right after Safer at Home expired. Restaurants and bars opened. 18 to 24-year-olds, ramped up, flattened out, and it came back down. And now we have the peak that we're in right now, which was really kicked off by those 18 to 24-year-olds again. That's testing. There's not a lot of detail there. It's worth sharing. 7-day average of results. Here's the trending by age group. So you can see that top line, that dotted red line is that, or orange line is the 18 to 24-year-olds, followed by the 20 to 25-year-olds, and then really a clustering of the rest of the age groups, from 30 to 60 plus. The only age group that's really below all that right now is still our school-aged population. And then just, to further illuminate the increase in cases, I don't know if you can see my pointer or not here, but essentially if we, let's just, if we take the top line here, the under 18s, we've had 125 cases in the past 2 weeks. That's a case rate of 404 per 100,000. We consider anything over 350 very high. Our goal is to be under 10. And so what this means is that in our under 18s, we've more than doubled in the past 2 weeks. So 104% increase. That represents, over half of the total cases now, with a doubling time of roughly 2 weeks. And so you can see that for all the age groups, and you can see that the percent increase in cases is almost 100%, representing a doubling in 2 weeks. Let's see here. Oh, and then I have the live version of this one too right now, but I think this will suffice. So these are the hospitalizations that are occurring in the Fox Valley area, dominated by Winnebago and Outagamie counties. And you can see that we went from activity that was manageable to activity that is really starting to threaten the capacity of our area hospitals. They are starting to gear up overflow capacity in Madison in the event that hospitals start to become overrun in the near future here. And then, as I mentioned, we're not alone. A lot of the states at a high level, but the Fox Valley is really a hotspot. And then we're going to shed that honor relatively soon, if we can modify behaviors. So, with that, I had just one other. Do this. Can you see that graph? Did you see a new chart just now or no? No. Okay. Let me just stop in my sharing, and then I'll just reshare. This is our website. So this is the dashboard of our website, and you can see the cumulative cases that we have to date. So pushing about 4,000 total cases. Again, a fraction of the total number of cases. These are the ones that are just confirmed with a positive PCR test. And then going right now. And then on the right here, you can see kind of that distribution by age group and where the cases are. And then, of course, we have it, and then we have other information on the website. Since you can look at that on your own, I won't spend any more time on that. And then this is today's Wisconsin Hospital Association report. And actually, it looks like the number is the same, 112. So maybe that was pulled from today. And then the percent positive tests and total tests per day. Our percent positivity is going super high. And it just means that we don't have enough testing despite all the additional tests that we've added. So with that, I'm going to stop sharing and would love to hear some questions that you have based on that presentation. And then I would really appreciate hearing from you. Where do we go from here? Clearly the recommendations that have been laid out have not been effective. We don't have voluntary compliance in such a way that it limits spread of disease that is now going to have a really serious impact on our community. This is what we've been trying to prevent, getting to this point. And we've not been successful. And really it's because we just don't have enough distancing and mask wearing to reduce spread. So households are still number one place that spread occurs, but people go out in the community, they become exposed, they infect people before they even have symptoms. And so until we can stop that, we're going to continue to increase those cases. We're making recommendations today that now all schools go hybrid or virtual. It's really up to the schools to whether they want to do that or not. But given the number of cases in the community right now, we fully expect many cases to show up at schools and result in the quarantining of others. We can limit that by assuring that within schools we truly have a good distancing and masking in place at all times. And hybrid's better than all virtual. And you can see, you already know that we've had to go all virtual in a number of places already. I'll leave it at that for questions to start here. I'd love to have a dialogue with you. So I see a couple I can read from the chat here too. Is the testing of students at UWO including Winnebago's numbers? Mostly not. There are some, but most of the testing that's occurring at the university is antigen testing, and so our test numbers, if they're PCR positive, that's a confirmed case. In the case that someone is symptomatic and has an antigen test positive, those might start to populate, but there again, every test, no one is counted more than once in a 90-day period. So if someone's tested 5 times and is positive 5 times, it still only counts once. The activity off campus is far higher than it is on campus. There's roughly 2,000 students in the dorms right now. They're being tested once every 2 weeks. They've ramped that up. Now just about every student that's in the dorms is getting tested about every week. We have another CDC team in town that we just invited to help out with UWO and do an analysis of antigen testing here and in Madison. We had a CDC team here earlier in spring. We're still waiting for the final report from that one. I'm hoping to see that pretty soon. I know that there's a draft MMWR that is looking to be published, but we still haven't received any kind of an approved copy of that to release to the community. So I don't know that it's going to be incredibly revealing at this point, but it was really a focus on, why did we have that initial spike in 18 to 24-year-olds? What were the conditions here for that? And we've the recent spike just pales that one that we had in spring. Let's see. Most everyone I see is wearing a mask in stores. Is there a scientific study to prove that it helps? There are lots of studies and lots of evidence that show that masking works. And so we have no doubt that masking is effective, but it requires a level of participation at a high enough level for it to really be effective. So masking helps, and it can help a lot if we have, really the entire community participating, or even close to the entire community participating, and that people don't forget that distancing piece is important too. If an employee, I have an employee out with COVID, when would you recommend they return? Symptom-free for how long? So basically, if an employee actually has COVID, 10 days from the start of symptoms. And ideally, at least 24 hours past symptom resolution. That normally happens. Most people recover in far less time than that. In fact, that's part of the problem. People feel good. They may have an illness for just a couple of days, but they're still infectious to others. And then they come back to work, or they go out in the community and they infect others. And that's part of the reason we have the situation that we do. It's just that when those vulnerable people get hit, they get hit really hard. And that's why we have so many people in the hospital right now, because it's those more vulnerable persons that are filling it up. The let's see, symptom-free for how long? Yeah, 24 hours. So ill people should stay home right now. And if we do a good job, the confounding thing that we're running into right now is flu. Flu season is just starting out. Evidence seems to indicate that if we do a good job masking, we may not have a very challenging flu season either. The whole respiratory season. If we look in the Southern Hemisphere, Australia and South America, where they've gone through their flu season, those countries that had good masking in place had very low flu rates. And another example of that is right here in spring. We had a pretty good flu season going, and when COVID hit, and when we shut things down, flu season ended as fast as we've ever seen it end. And it should have went for weeks longer. It just fell in a 2-week time period. So the more we mask, the more we'll be able to identify COVID easily, because we're not going to have as much other respiratory illnesses that look like COVID. And that's also great, for the population as well. So flu shots are definitely important this year again too. I know someone that had a child that needed to quarantine after potential exposure. His parents were not required to quarantine and continued to go to work because they didn't have a quarantine order. This doesn't seem to make sense. Is there a recommendation to immediately household members of those quarantine? No. So I'll use my daughter as an example. She just got told today that she was a close contact to someone that tested positive. So she's sent home, and so she self-isolates at home. And so what we'll do is, she'll stick to her room. We'll, make sure that she's wearing a mask all the time. Be careful about, the space that we're sharing, and just wait for her to develop symptoms if she does. Hopefully she won't. In addition, we're just going to have her tested, because if you've had an exposure, the earliest point at which you should get tested is probably 4 to 5 days out. Well, we just found out today that she was exposed like 7 days ago. So she's going to get tested now, and then she'll be off school. She'll be at home. She won't be going, she won't go out anywhere. Has to cancel all her plans that she may have had. And then we'll just monitor her for symptoms until the 14 days, and then she can go back to school. So, when a contact to a contact, think of it that way. So you have someone that's a contact to a case, they're the ones that are quarantined. But if you're a contact to that person, or that contact to a contact, we don't have a recommendation that household stays home. Now, clearly, if Kelly was positive, if she actually has COVID, well, yeah, I'm stuck where I'm at home here for, another couple of weeks myself. So, so many people don't trust the statistics. And I think the numbers are political. I think when the death numbers are released stating the age, and if existing conditions existed would be helpful. Yeah, I can tell you, so we've had 26 deaths so far. Most of those have been, I want to say about 80% of those have been age 80 or older. That does not reflect what's happening statewide. I just talked to the radio this morning. Only statewide, only 46% of cases are in ages 80 and above. We've had two cases in their 30s, one in the 50s, one in the 60s, one in the 70s, and the rest have been, most of them have been in the 80s, and then I think maybe a couple in the 90s. I think what's important to note here is that those are all premature deaths. A year ago, those people wouldn't have died, from this illness, and they wouldn't have had these years of lost life. Families are losing loved ones that they don't need to lose, and it's not just those that are elderly. And some of these people are, they're healthy. They've got a lot of years left, and COVID's just taken them out. So we're doing our best to protect them, but we are definitely shortening the lives of a lot of people. And on top of that, there's just more and more emerging evidence about the long-term effects of COVID. I mean, when you have no sense of smell or taste, that's a nervous system attack. There are people that don't have their taste back for months. The cardiovascular system, attacks, young people, athletes with, continuing heart defects, from the attack of COVID. So it's not just about dying. You can see the hospitalization numbers, and it's the long-term impacts that we don't know yet. You don't get shingles unless you've had chickenpox first. If you can prevent people from becoming ill, you can hopefully help prevent those additional health impacts and health costs down the line. So avoiding illness is still the best way to go here, because we just don't know what those longer-term consequences are going to be. So we'll actually, now that we have more deaths, we'll probably push more statistics out about those deaths. But I would focus more on hospitalizations, and ER visits than I would deaths. That'll give you a bigger picture of what the true impact of this is. If you get hit by a car and you don't die, it still messes you up, for a long time or the rest of your life. And that's what we're seeing are people that, become ill. They don't die, but they've got really long-term consequences from this. And that's going to be a burden on our healthcare system for years to come. Are employees required to pay an employee if they are out with COVID? That varies. There are some benefits that are available for employees. It really depends on the employer and what they're eligible for, and whether or not they are considered an essential employee. Like first responders and others typically don't get benefit for being off for COVID. Unless it impacts them. If it impacts a family member, no. And typically, if it impacts them, it's only at the employer's choice. So there are a lot that can, and I think that's one of the keys here is having adequate funding available that people with COVID can be home. And we certainly know that that's an economic challenge. It's 2 weeks of being home and missing a paycheck or 2 paychecks. It can cripple a lot of families, and so when we're looking at what we can do to help reduce this funding, for people that have to stay home, is certainly a part of that, and employers are in the best position to to fight for that and to help make sure that happens. Doesn't matter what type of mask to wear. You see disposable cloth scarves. Typically, anything that's like a dual layer type of mask is the most effective. But certainly, most any cloth covering will suffice, and certainly surgical masks will suffice. Gaiters, we don't really recommend, at least in an indoor environment. They're really popular with athletes, and you see them out on the professional football field and things like that. But the gaiters are, many of those are very, very thin and may not do much to reduce respiratory droplets from escaping. And so really, as long as it covers your nose and your mouth, and it doesn't have a vent, it's likely to be effective. But like I said, try to stay away from the gaiters. Help with the math. If your daughter's exposure was 7 days ago, does she quarantine for 7 days or an additional 14 days, which leads to 21 days from potential exposure? So in her case, she will quarantine for 14 days from the last day that she was exposed. And what we found out was that she was exposed a week ago. So, and hasn't had an exposure to that individual since. So she will quarantine for another 7 days, and that'll be the end of her 14, unless, of course, we find out in the meantime that someone else was positive and she was exposed to that person, which could extend the quarantine again. The only other thing would be is, so mom's taking her to get tested right now. If she tests positive, she'll be out a minimum of 10 days from today because she has tested positive. She doesn't have any symptoms, but she may, if it's possible that she's developed an asymptomatic infection, still has the ability to transmit it to others, and so would have to be home in isolation for 10 days, which means that she would have a further restriction from the rest of the family for that duration of those 10 days to help assure that we don't develop disease as a result. And that, that starts the quarantine period for us. And so anytime we're a close contact to her, anytime within her 10 days, if she is positive, starts that clock over again. I know of a 94-year-old who passed away in Winnebago County from heart failure. When his son received the death certificate, it listed COVID. So why would we want to believe the numbers of deaths when this is happening? The physicians typically make the call as to whether or not it's a COVID-related death. People don't die from COVID, much like they don't just die from flu. They usually die from some complication. In the case of flu, usually it's pneumonia. In the case of COVID, it's usually an exacerbation of some pre-existing condition. So, the person that died from heart failure, it was complicated by COVID, or the COVID exacerbated the condition and led to the death. In fact, there was a study that was just out. When people go into cardiac arrest that have COVID, you almost never can bring them back. So far the evidence shows that an extremely, extremely low percentage of people with COVID will survive a heart attack, which is certainly not the case in the general population. So just kind of coming back around again and wanting to hear more from you. What do you see as the business community as, some reasonable steps that can be taken to help turn the curve here? Because we're all headed down a really bad path right now. I talked to our IEH staff, they can list 6 or 8 businesses that closed in the last 2 weeks just because they don't have enough staff. This is going to keep going and going and going. We have months and months of this left. I'm hoping that in a year from now, we'll be starting to see, a population that, is somewhat sufficiently vaccinated that things start to get back into control a little bit. In the meantime, we're going to be sending a lot of people to the hospital unnecessarily, and we're going to amount the deaths even more in our community. And it's just, it's going to be hard for businesses, to operate when, they start infecting large numbers of employees. Come on, guys.
Hey, this is Karen, and you're talking about 6 to 8 companies that are closing because they don't have enough staff, but yet we're hearing 6 to 8 bars that are closing as well because someone came, was exposed with COVID and was positive. So the city is supposed to be having a workshop here soon
They are.
with the business community and the Tavern League. Sitting in your chair with all of the feedback and information that you have, if you were at that table, which I think you're going to be, if I'm not mistaken,
I will.
what will your recommendation be? Because I can say personally, we'll see on Facebook that there's a restaurant saying, don't forget us. We go there, they're slammed. We drive through the parking lot and we leave because we're not going to go in there because obviously they're not social distancing.
Yep.
So what will your recommendation be to the Tavern League and to the city when this happens next week?
Sure. So we have, a number of businesses that are doing, going, through an extraordinary effort to protect their employees and to protect the community when they enter their establishments. We need them all to do that. And unfortunately, that's not happening, as you witness from packed bars, packed restaurants. Those are people in close contact for a long period of time in an indoor space that may not be well ventilated and exposes a large number of people. Those people, take it home, they infect the rest of their family. That infects other businesses for people that are working at home. It infects kids that go to school and take it to school. So until we are actually somewhat serious about physically distancing and masking in all locations, we're not going to start working our way out of this. So we need universal participation in that. What is it going to take to do that? What is it going to take to have all restaurants, bars, businesses to ensure social distancing? What's it going to take to not have group gatherings, weddings with 200 people, other events in the community where people are infecting one another? What is it going to take for that to happen so that we can see a reduction in cases?
Probably going to take a gazillion-dollar stimulus package. This is Robin. When did you say that the vaccine will be here, or what were your thoughts on that?
There are multiple vaccines in development. It'd be great to see one, by the end of the year or next year, early sometime. I think we'll see initially some vaccine come out. It'll be in a limited amount, but it'll probably be well into next year before we see a flow of vaccine where we're starting to vaccinate, large numbers of people. Couple more questions here. Verve has changed lobby visits to appointment only again in order to avoid needing to shut down branches entirely. We're hearing more and more places right now. Hospitals are moving in that direction as well. Nursing homes have been there all along. Do hospitals get a kickback when people are admitted for COVID? Not that I'm aware of, but I'd be happy to ask that question. I don't believe so. It's very, very expensive to keep people in the hospital. And I can't imagine that there's any amount of kickback or funding that makes it worth keeping in someone longer than necessary. My company has required masks since March, has intensified cleaning procedures and frequency, and provided hand sanitizer everywhere. Unfortunately, when we trace the positive cases, our employees have been infected on the weekends, not while they're at work. I don't know what more we can do. Mary Beth, it's what you do outside of work matters. And that's the message we've been telling businesses all along. If you want to protect your job and your employer, you need to not engage in activities that expose you to the virus. And that's where the group gatherings, the parties, the holiday celebrations, the weddings, You know, you know, having, you know, bunches of people over for dinner and traveling. I mean, that's where all of that comes into play. You know, businesses can do an excellent job of keeping transmission from occurring in the workplace, and yet people still can become exposed, you know, on their own time. I think that that is a very, I mean, that's a very important point, and one that shows that we need to have, you know, not only compliance from businesses but from individuals, and what will it take to do that?
Well, Doug, I know you have another meeting you have to get to, so I want to respect your time. Very much appreciate all the information that you shared with our organization. So thank you for that. Just a reminder, we do meet the first Thursday of every month. So for those that are interested in joining us for our next meeting, that is November 5th. And we will be having the Sheriff Matz from the Winnebago County Sheriff's Department. So that should be a great session, and we will keep everyone informed on that moving forward, what that looks like. So thank you all for your time today. Thank you so much again, Doug. We appreciate everything and all the information and everything you and your team have been doing. So hopefully we will see everybody in November. Have a good day.
Thanks for the invite, and happy to come back again.
Thank you.